You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, gum recession. There's a new technique that allows people to get rid of their receding gums, their cold sensitivity, without traditional surgery. With us, we have Philadelphia's periodontist, board certified Dr. Stephen Brown. Dr. Brown, welcome back to the program.
Thanks for having me back again. I'm really excited to be here.
Good, good. Now, for people that don't know your practice, because we've had you on the program talking about dental implants, no more dentures. Also, you're using lasers, so you're getting rid of gum disease. And now this new pinhole technique for receding gums. So for people that don't know your practice, I mean, who's a typical patient you see as a periodontist?
Our patients come from all walks of life. We're a downtown Philadelphia practice. People come in from the suburbs. I have patients who come from out of the country. I have patients from Bermuda frequently. People come because they're looking for an alternative. And over the years, what we've attempted to do is go from maximally invasive procedures to minimally invasive procedures. This is what's going on in medicine, and the dentistry has followed suit.
Now, you know, on the telephone, we were talking about this. You said this is a very exciting time, and you love this technique for gum recession. Like it's almost invigorated you. I don't want to put words in your mouth. But
I am so enthusiastic about it because I've done every possible type of treatment for gum recession over the years, surgical treatments, and most of them were very invasive. And patients would have a lot of discomfort afterwards. Basically today, we don't use any narcotic analgesics. All of our patients are being seen the next day, 24 hours later. All they tell me that they've ever taken is a little Tylenol and or ibuprofen. So it's exciting because patients aren't hurting. I used to describe to them what we were going to do, and we've come a long way over the years. They used to have a procedure in which they would take tissue from the patient's palate.
And we're talking about gum recession. So somebody with severe receding gums, causing like cold sensitivity.
Patients come in for a number of reasons.
Okay.
They come in because they smile and they see the discoloration of the roots of their teeth. They come in because they're super sensitive, and they'll tell me they go out for a run and they can't breathe in and out, and for sure they can't have iced tea or ice cream. And the third reason they come in is that they're frankly afraid of losing their teeth because they see the gum going down the tooth and they come to the conclusion, I may be losing these teeth. So those are the major reasons that they come to see us. In the past, the methods that we had available are traditional methods that work, but they are problems. There are problems associated with them because patients hurt afterwards. Think of the idea of having two areas, two wounds, as opposed to one. Think of the...
Well, okay, now let's back up for just a moment for people just tuning in. So people with receding gums, as a periodontist, the way you would treat it before is you would, like with a potato peeler type of an instrument, you would take gum from the roof of their mouth.
That's exactly right.
Transplant it over the bottom of the tooth that was exposed. And now they have two sites that are kind of sore, and they'd have to heal. And then you say that it doesn't always heal just right. It doesn't always look that good.
It's not predictable all the time to cover roots.
But you did a lot of that surgery?
Absolutely did
Every
a lot of it.
periodontist does a lot of that?
Every periodontist. And you can have phenomenal results with it. But you pay the price of two painful areas, much lengthier procedures, and the fact of the matter is if you're doing multiple areas, and we see patients with recession all over their mouth, if you're doing multiple areas, you can't come back to the well that often, to the palate. You've got to wait till it heals, the tissue's got to be right, and that takes, so if you had 3 areas to do, it could be 3 months apart each one. It could take a year to get it done. In 1 hour and a half, I can do from the molar on the right side to the molar on the left side. Patients can see the results immediately. That's the most fabulous thing about it.
So they walk out, they might have a smile with receding gums everywhere. And they walk out without those receding gums.
And they walk out, we show it to them at the end. Literally, I've never had patients cry in the chair for joy.
Really?
Because they have been looking at this a certain way, and it's magical. because within it, I don't want to go too far with this, but it is literally magical because they can see the results in an hour.
So this crowd, the gum recession crowd, is it really a big, I mean, a lot of people? Like
It's a massive problem.
Really?
Yeah, it's a public health problem.
And so people put off taking care of it because of the painful surgery.
They have been told what the surgery involves. Some of them conjure it up in their heads that you're going to take tissue from here and you're going to transplant it over there, and you can only do a couple of teeth at a time. That's a problem. And people don't want to have discomfort. The truth of the matter is, within an hour and a half, you can do a whole upper jaw. The patients walk out of there. We see all our patients at 24 hours. It is rare that anyone comes in and tells me that they had a lot of discomfort. The truth of the matter is Tylenol and Advil will deal with it. I haven't prescribed a narcotic analgesic in the last 3 years.
Okay, so for gum recession, the gums are going up. You were transplanting tissue on there, big downtime, lots of pain. Now you're actually, like on the upper, you're pulling the gum tissue down like a drape.
I would eschew the word pulling down. We are freeing it up, and it literally comes down, and they don't have to have any sutures. They don't have to have any incisions. They're not going to have any of the same discomfort. You use a few tiny pinholes, and through those pinholes, the instruments separate the gum. The gum becomes loose, as you said. We can pull it down just like a cuff or just like a drape, and we use little collagen strips to hold it in place, so you don't need any sutures. And we see these folks at 24 hours, and the change is just dramatic.
So you don't do it the other way anymore?
I haven't done it the other way in almost 4 years.
Now, I spoke to one of your office managers. She works in the office, and she says, Dr. Brown, and I'm paraphrasing slightly, didn't even want to talk. You know, it was dreaded the call when you were doing the old gum recession surgery.
That's true.
Because the person was in pain. Is that right?
Yeah.
And now,
I didn't want to describe it to them, because if you start to describe to somebody that I'm going to go to the top of your mouth and I'm going to remove a piece of tissue, and then we're going to have to suture that up, and now we're going to take that tissue and going to transplant it down to another part of your mouth, and we're going to suture that into place after incisions, etc. That doesn't sound like a lot of fun. We used to refer to it euphemistically as it's going to feel like a pizza burn.
Yeah.
On the palate. It's nothing like a pizza burn.
It's worse. They say it's worse.
Much worse. Much worse. And no person that I've ever met that's had it done years ago didn't remember what that was like.
You know, I was talking to, just yesterday, a general dentist and about the traditional gum surgery. He says, oh my goodness. He goes, when I know the patient and I've got to send them to a periodontist to get this gum surgery, I feel sorry for them.
That's exactly right.
Because of the pain they're going to have to go through.
Dentists and dental hygienists are living with these patients, trying to use other methods to get the teeth desensitized or to look a little bit better, because they don't want to send them out, because they know what this procedure is.
So with the new procedure where you just pull down the gums, if it's the upper, I'm saying pulling it down, or on the lower, kind of unfolding it, unraveling it, how soon does the sensitivity go away?
Sensitivity will go away almost instantaneously, because the area that's sensitive doesn't have any enamel on it, where the gum is receded down the root. Now it's got a cover over it. So instead of running outside with a t-shirt wet and it's cold wind, all of a sudden the t-shirt is no longer wet and it covers the tooth.
So they could also eat too?
Immediately.
Is that right?
There's no restriction.
But the other way is not.
Obviously, it isn't accurate completely to say there's no restriction. You wouldn't want them biting on a hard crust of bread. Yeah. You wouldn't want them biting on gooey foods.
So take it easy at the beginning.
Yeah, for a couple of days. But when the patients come back the next day, even before that, when we finish the procedure, they can see the results immediately. I give them a mirror and I show them, and that's when I said patients not only smile, they're amazed because they've lived with this for a long time. It's a chronic problem.
Is it true it could also lead to, making your teeth loose and potentially losing your teeth?
Well, a lot of people are afraid that will happen. I mean, gum recession by its nature or by its definition means that there has been some loss of the tooth supporting bone, because there's a relationship between the gum and the top of the bone. And as the bone goes south, the gum goes south with it. That's one of the reasons why we get recession. So people are concerned. I'm not going to tell you that just recession is going to cause you to lose your teeth, because that's just simply not true.
Okay.
But this is a way to correct it, and it's a better way than what's being done.
So even in your town, it's being done every single day, where they're doing surgery on the roof of the mouth, transplanting it to their teeth, going through the downtime. It's happening every day in your town.
It's the norm.
Even in downtown Philly?
It is the norm. I'm not the only one capable of doing this, but it is the norm.
But not a lot of guys. Less than 1% of periodontists are probably doing
Pretty
this.
small percentage. When I took the course in 2013, I think there were probably less than 5% of all the people who were periodontists.
And insurance and things like that covers a small portion. They treat this just like they do the surgery.
The insurance
So
company,
one doesn't cost more than the other.
No. Insurance companies will treat it exactly the same way. It is gum grafting. It's just a different method of doing it.
So when you call the patients after they've had it done, so they had receded gums, now they're all good, what do they say?
They say, I can't believe it was this easy. I can't believe I didn't have pain. I can't believe the way I look today. At 24 hours, they can see a dramatic difference without a lot of swelling, without a lot of redness, without a lot of pain, without a lot of discomfort. They love it.
So in dentistry, backing up, because I've had you on the program before, and people need to know, I'm not trying to endorse Dr. Brown. Obviously, I'm a fan because I've seen your work, but that in dentistry, it's been a lot of patchwork, right? You lose a tooth, you get a bridge or a root canal, and they're temporary fixing things. And then dental implants came along,
right?
You get your tooth back. So that's a big change in dentistry. Now, and then the other problem people are facing is gum recession. And you really had nothing to do to take care of it, except for the older surgery.
In the past...
So this is like the newest, hottest thing in perio?
Absolutely. In the past, if they weren't doing the other kind of surgery, dentists and hygienists would attempt to treat the recession by treating the symptoms. So consequently, either they would use some kind of paste that would, or a desensitizing agent that would help to reduce the sensitivity, or in many cases, dentists will put a veneer, not the kind of veneer for making teeth pretty, but a veneer over the root, so it would be almost like a protective covering.
Okay.
The problem is that makes the situation worse, because over time that discolors. The edges of those fillings, no matter how well they're done, collect bacteria, and that contributes to periodontal disease, which, by the way, is one of the ways in which people get recession. Because if you have gum disease and you lose the bone, the gum follows.
Do you ever use your laser in combination when they do have gum disease?
Absolutely. If there is inflammatory gum disease, I'm not going to do this procedure until the gum disease is under control.
So you clean it up first?
Absolutely.
And then do the...
Where necessary, we do that all the time. I'm not going to operate in an area in which there's essentially infection.
Now, okay, we should mention a little bit about your credentials. I mean, you teach at Penn, at Albert Einstein, and Temple University.
For the past close to 30 years, I have taught. I'm professor of periodontics at the University of Pennsylvania. I teach in the postgraduate program with the residents who are learning to be periodontists. I do the same thing at Temple University School of Dentistry, and I'm the director of the Implant Center at Albert Einstein Medical Center.
It's very nice, on the phone. And I was throwing some trick questions at you just to kind of get your motivation here. I said on the phone, well, why do you like it so much? And really, it was all about because the patients don't have to suffer with this surgery that isn't that predictable anymore. To you, it was like about a happy patient, which was interesting to me. It wasn't about the money or whatever.
The patients have no pain, and they are happy because they are getting almost instantaneous results. When I say it's no pain, patients don't complain about discomfort.
But there is some discomfort.
Yeah, they're going to have a little bit of soreness, and I'm telling you that, as I said before, Advil is not very strong. Tylenol is not very strong, and some of them don't take that at all.
But the people that had it, the old surgery, and now they had this,
They can't believe it.
Really?
And I have many of those because sometimes the old surgery didn't get the result that the patient had hoped for. In other words, the recession wasn't covered, or they have some scar tissue that needs to be rectified. They can't believe it because they've been through that other thing and they didn't forget it. You don't forget.
They vowed to never do it again.
Exactly.
You said some people.
Exactly. It's until you can talk to them and tell them how this is so much different than that.
Okay. So now what about the sensitive toothpaste? So after you do this technique, get rid of their receding gums, do they no longer have to use like the sensitive toothpaste?
No, not only that, they tell me they go out and they can have an ice cream soda.
Okay.
They can have a cold beer. I mean, they don't have that problem
You say
anymore.
even runners, like people running, the cold air hurts?
Absolutely. I can't tell you the number of times I've heard that. At first, it sounded so strange to me because I wasn't thinking of somebody running, being exposed to the elements that affect their teeth. Other areas of their body, perhaps, but not their teeth. But yes, I've heard that many, many times.
Now we're short on time, but you have some photos. What are we looking at?
So let me show you.
All right.
This was a beautiful young woman, and you can see the recession on that side. She didn't want to smile, and you can see her almost immediately after, and this is at 3 months, so you can see that it doesn't recede again.
So that recession right there, it also has a dark color above it.
That's exactly
Is that the
right.
root?
The root of the tooth is a different color than the enamel on the crown of the tooth. It tends to be yellowish or yellow-brownish. It's not pretty.
Okay.
And the truth of the matter is it gets worse because saliva and other things having acid in it make it worse. And scrubbing it with a toothbrush. Toothpaste is abrasive. So if you use a scrubbing method of toothbrushing on recessed gums, you're going to have grooves in the teeth.
Makes it even worse.
It wears it away, makes the sensitivity because you're closer to the nerve.
So when I look at that before with the raised gum, so you basically, you go in, you use your instruments, you kind of release that gum, you bring it down.
Right.
You do the little pinhole, put the stuff in there to keep it down.
Yep.
And then they walk out
And they walk out.
But they look in the mirror that day, did they see something like this?
Randy, it is so compelling to watch a patient who came in and they didn't like their appearance, and you give them a mirror and you see them open up, and then the tears come, and then the tears
is that
come.
right?
Yeah, it's very rewarding.
Okay, so the next
So
one.
in this picture, you can see a lot of recession and big spaces between the teeth. They get food in there, saliva goes there. Today, we can pull that tissue down, we can put it into place, and they look like this at a couple of months.
So you're an educator, 3 universities. Does it cost more to go to a guy like you? I mean, because you are, by the way, people need to know you're kind of like a legend. Like some guys will say, Dr. Brown's on your show. You know, because every periodontist seems to know you, at least everyone I've ever talked to. But so does it cost more to go to somebody like you?
It doesn't have to. And by the way, getting it done right the first time is the least expensive way to possibly go. When you got to do things multiple times, that becomes a lot more expensive.
All right, we're going to, now you brought a video about, it's an animated video of how to fix gum recession. It's kind of mind-blowing. But you have a couple more photos first, and then we'll...
Well, here's an extreme example. Not only have the gums receded tremendously, not only are there big spaces between the teeth, but if you can see the roughness on the root where that is being dissolved away. This is a very uncomfortable patient.
So they're in pain.
They're in pain. In one afternoon, I did the entire upper jaw, and this is what it looks like at 1 month.
Wow, I mean, that looks good.
Not only does it look good, but they're symptom-free, and believe me, they remember the way they looked before and the improvement that they've gotten. A dollar value you can't place on it. And people like to smile. They don't like to do this, you know?
Right.
So this is a person for 40 years that had recession. She not only didn't look well because you could see it when she smiled, but her teeth were extremely sensitive as well and much more prone to decay. She brought me pictures of her from her high school prom. And you could see she was a beautiful young lady. And yet she had this recession in the upper front of her mouth. She didn't know what to do about it. She'd heard about the other methods as she grew older.
But there was no way she was going to do
There was no
surgery.
way she was going to do it. She had it done, and in a short time.
Let's take a look at that after.
And we've seen these patients now. I've been doing this for 4 years. We've seen 4-year results.
So if a patient's watching this, they're already happy with their general dentist. They know they have receding gums. They could go to you, and you can fix it in one afternoon, they could still go back, get all the cleaning and everything from their general dentist.
Absolutely.
Because as a periodontist, you don't maintain them.
No, as a matter of fact.
So you work with their dentist.
I work with every dentist on their patients. I get a lot of referrals from hygienists, and the hygienists are the ones who are seeing them. And when
Only the smart ones, right? You're getting referrals from.
And when they're scaling their teeth or cleaning their teeth, the patients are hurting because they have this exposure. So hygienists are a tremendous source of referral because they want to see these patients better.
Okay.
And they care about them a lot.
Now, you have a video that explains the old procedure and the new procedure for gum recession. And so kind of walk us through it. Explain what we're seeing here.
Randy, look at the gum recession here. This is the way it used to be done. They would make a flap, they'd elevate the gum tissue, they'd take a piece of tissue from the top of the mouth, the palate. That piece of tissue would be transplanted. They had to suture it closed so the palate was uncomfortable.
So now they're transplanting it right here.
Now they're going to transplant it over the roots of the teeth, bring the gum down, and they put a bunch of sutures, as you can see.
Oh my goodness.
Those sutures are to hold the graft in place. They're quite painful, and they oftentimes have to be removed. They're not necessarily dissolvable. Today, all we have to do is a little pinhole like you see here, maybe several of those little pinholes. We introduce an instrument that allows the tissue to be moved downward, in the case of the upper teeth, and cover the gum. Once that's completed, through the same little hole, we put some collagen strips. You don't have to have any sutures to hold the gum down, and it keeps the gum in place.
And this happens in about an hour?
We can do a whole upper jaw in an hour to an hour and a half. It is very, very quick. It is less, by far, invasive, and the results are very predictable. Look at the side-by-side comparison for correcting gum recession. Over here, cutting and a lot of stitching. Over here, a little tiny pinhole that allows the instruments to do the job of moving the gum down.
So it's that easy. I mean, it looks pretty good. Looks
You know,
easy to
it
do.
looks very easy. It is a little bit technically difficult, and you have to learn it. But for the patient, that's the important thing. For the patient, it's wonderful because they get it, they're in, they get it done, they can see immediate results, and they have little, if any, postoperative discomfort.
We are short on time, but what about somebody that just has one or two teeth with recession? Like they're canines. I'm talking about myself.
Right.
A little bit of recession. Is that okay to come in and get it pulled down?
The time to treat it is as soon as you possibly can, because we don't want to see it move from one tooth to another tooth. The fact of the matter is, I would rather treat one tooth than have to treat someone's whole mouth.
So like anything else, it's a lot less expensive to get it done early.
Do it right, do it once, and you don't have to do it again.
Okay, so no more gum recession. No more cold sensitivity. Is that right? You think you could wipe it out in Philadelphia?
I would like to be the one to do that. Absolutely.
Okay, good. We are, final message. Somebody watching this, they have gum recession, maybe their loved one has gum recession with cold sensitivity. What do you say to them?
Look for your options. Hear what's available. Today you can go on the internet. Everybody does. They come to me and they've already researched this thing. Don't necessarily rely on one solution, because to any problem there may be multiple solutions. This solution, in my judgment, after doing gum grafting for this many years, is that this is so far superior that I can't look back again.
And when you speak at meetings as a periodontist, I mean, you're telling them to do it.
Absolutely. And I speak a lot to a lot of groups, and this is so, I'm so enthusiastic about this that I want to share it with the world. I absolutely.
You're serious about that? Because you said that to me on the phone the other day. I got off the phone, I said, is this guy serious?
No, I am serious because I know what other people are doing and what they can be doing and the results that they can get. It's just a matter of deciding that I'm going to try something new and I'm going to get the instruction on how to do it from the people who invented it. And in this case, that means going and visiting with Dr. Chow in California.
So in most cases, you could do this in one afternoon?
Absolutely. One upper jaw, about an hour and a half, about an hour and a half for a lower jaw.
Now, we have a video, and I asked, I want to show it on the program. Let's go to that clip.
Oh, I forgot to take the glasses off, sorry. They were saying don't do it, they have to cut. I said no, they don't, he doesn't cut.
The most traditional way is for the doctor to take a sliver of gum from the palate and transplant it to another part of the mouth. There's no incisions, there's no scalpels, there's no suturing. We put these little strips of collagen and they hold the tissue in place. You see the results virtually immediately.
It's as if I never had anything done in my mouth. I was eating and drinking as soon as I got home. There was absolutely no pain.
I met Dr. Brown 1 year ago, and he has changed my life. The reason why I came here was because I had a graft gum procedure done 2 years ago, and it was not done right. I was not confident anymore with my smile, and I stopped smiling, and I love smiling. Came here, I talked to him, he asked me what I needed to get done, and he did a lot of research. I got my procedure done after a few visits here. He is amazing. I didn't even know. I didn't even feel it when I got my surgery. I forgot about it. I had immediately results right away. I was really happy with it. I didn't feel any pain. I just was amazed with the results. I can smile now. I feel me again. I got my confidence back. I will do this procedure again because I'm happy and I'm myself again. I'm just amazed with the results. I'm really happy and I cannot smile anymore. I feel myself again, and I'm very thankful for Dr. Brown because he is amazing as a doctor and as a person.
I have receding gums, and my dentist recommended that I do gum grafting. I went to a doctor that he recommended. The procedure was not what I thought. It was actually really horrible. I knew I had to do something. I saw the pinhole drop on the news. I Googled. Dr. Brown was the first one that came. I made an appointment to come in for a consultation. I knew this was the right move. It's been 5 months now, and I've been absolutely wonderful. My teeth have never looked better, and the sensitivity is completely perfect, and the experience was wonderful, and it wasn't as bad as I thought it was going to be, and Dr. Brown did a wonderful job.
It's very nice.
That's common. Everybody is thrilled with this procedure and what it can do.
Okay, good. So now, if somebody is watching this, they come in, it's free consultation?
Consultation is free.
How soon will you be able to tell them whether you can do this or not?
Same day,
Same day.
while they're there.
Can they ever be too far gone? Like their gums are too receded?
There's always something we can do.
Okay. I want to thank you for coming to the show. Always a pleasure.
It's always a pleasure to be here with you because you see things that other people don't see about what we're doing.
Well, good. Thanks again. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.